Vitamin D plays a significant role in the development of sustainable muscle. We know that, in general, vitamin D is essential for the body, and in athletic and sports training contexts, its importance is amplified. Yet several of us who engage in rigorous physical training often overlook the significant role of vitamin D in strength, endurance, and performance. The dominant emphasis is on other factors. For example, in strength training and athletic endurance, typically the focus is on protein intake above all else. But the efficiency of protein-rich diets is also subject to complex macronutrient and micronutrient interplay, such as the impact of deficient or suboptimal vitamin D. To be clear, here we're factoring in optimizing vitamin D, and we also touched on how extended high caffeine intake may affect one's vitamin D levels. Vitamin D is a lipid-soluble steroid hormone, which is naturally synthesized in the body through our skin and obtained through diet. Once synthesized or ingested, it undergoes metabolic conversion in the liver and kidneys to become active forms. So, healthy liver and kidney function influence these areas. Reputable sources suggest that a large proportion of athletes across various sports, both indoor and outdoor, and those who engage in intense training for personal reasons, may have suboptimal vitamin D levels. Some key factors are that intense physical activity may increase the utilization and depletion of the body's vitamin D stores, which are primarily stored in fat and muscle tissue. Therefore, based on these aspects, the physiological demands of training may require greater vitamin D for muscle function, including its indirect effects on muscle protein synthesis, mass, performance, power, immune responses, and calcium regulation. These, however, are just some of the areas in which vitamin D plays a role, directly or indirectly. Periodically monitoring one's vitamin D levels is essential, particularly for those who train intensively, follow vegan or vegetarian diets, live in colder climates, in winter months, and have skin genetics that affect vitamin D levels. Sources suggest that the most accurate marker for vitamin D status is 25-hydroxyvitamin D, 25-OHD, as it measures both dietary and skin-derived sources of vitamin D. Furthermore, vitamin D suppresses myostatin, a protein that inhibits muscle growth, suggesting that optimal levels of vitamin D contribute to this relationship. Without adequate vitamin D, the body may struggle to absorb sufficient calcium, phosphorus, magnesium, and zinc from the food in the intestines. As a result, bones may not be mineralized appropriately. Similarly, in adults, extended vitamin D deficiency may lead to abnormal mineralization of the collagen matrix in bones. This weakened matrix may fail to provide sufficient structural support, thereby heightening other bodily risks. The improperly mineralized matrix may exert pressure on the periosteum, a nerve-rich layer, and cause bone pain, a common issue among those with prolonged vitamin D deficiency. This deficiency may contribute to muscle weakness and discomfort. To optimize vitamin D for generally healthy adults, it's wise to base decisions on current biomarker levels. The type and duration of vitamin D requirements vary based on individual needs and health status. One size does not fit all. For example, being a fat-soluble vitamin, it accumulates in the body and differs from vitamin C in that excess amounts cannot be excreted. Therefore, intake should be limited to individual body needs. It is suggested that current intake and serum level standards are based primarily on European and North American populations. Still, these may not apply universally due to genetic variations in the skin's ability to metabolize and absorb vitamin D. Individuals with darker skin pigmentation have a natural sunscreen effect, which affects how vitamin D is synthesized from sunlight. Seasonal factors also influence vitamin D production. In winter, sunlight strikes the earth at an oblique angle, reducing exposure to UVB radiation, especially at latitudes above 37 degrees. Additionally, during early mornings and evenings, the sun's angle results in minimal UVB penetration into the skin. Knowing your vitamin D levels is crucial, as supplementing without this knowledge may be suboptimal. A limited study showed that individuals with lower pre-exercise serum 25-hydroxyvitamin D, 25D levels tended to experience greater muscle weakness after intense exercise. Supplementation may improve muscle function and peak strength. The negative effects of vitamin D deficiency are more pronounced when it becomes prolonged, leading to severe bone mineralization issues and structural problems. Short-term deficiencies may result in symptoms like fatigue or minor muscle pain, but significant consequences may arise from long-term inadequate levels. A holistic approach includes pairing vitamin D with healthy fats to enhance absorption, preferably taken earlier in the day. All of this is, of course, not conclusive, but contributes to holistically optimizing the approach to vitamin D needs. Subject to individual suitability and health status,